to your profession, add to your career, add to your CV. So we are not just learning for fun, but there's a certification that will also add to your professional process. I'm going to be sharing my screen now. Okay. Can you all see my screen? Okay. Okay, so today, like I said, we'll be looking at a review of evidence-based practical treatment procedures in palliative care in home care setting. Okay. The first thing we'll be talking about will be overview on evidence-based palliative care. What is palliative care all about? What is evidence-based palliative care, not just any kind of palliative care? So palliative care is a philosophy of care that starts at the moment of diagnosis of individuals with life-threatening disease. Terminal disease, can also call terminal diseases. It continues together with curative treatment until death and support families and other caregivers during grief process after death. So the process of palliative care starts at the moment of diagnosis of an individual with a life-threatening disease. Example, we have cancer, dementia, and other motor neuron diseases like stroke. So those set of people need palliative care, and this care can start from any level of it. Doesn't get to the point where the person is dying. That's when you start. It can start from the moment where the disease has been diagnosed. If a person comes and says, okay, you've been diagnosed with stage 1 cancer, palliative care can start at that very moment. It mustn't wait till when the person gets to the end stage of the disease. So this palliative care is not just to the patient, and it also goes cut across the family of these patients. Okay, because this terminal illness most times leads to death. So you have to be there for the patient, and also you have to be there for the family as well. Palliative care is accepted as one of 5 main components of national cancer control programs. It's one of the main 5 components of national cancer control programs. I mentioned cancer, one of the diseases that demands palliative care. So it has to do, under that program, we have prevention, early diagnosis, treatment, and palliative care by WHO, by World Health Organization. Palliative care services aim to increase quality of life. Let's note that palliative care aims to increase quality of life of patient and their families. Also aim to add comfort to the patient, because a patient who is suffering through terminal illness will have so many discomfort, pain, many symptoms manifesting. So the aim of palliative care is to just increase the quality of life, manage those symptoms so that it will not aggravate and make the person's life very miserable. So, and it is recommended that it is presented with an interdisciplinary team approach. It's not a one-person thing. It's not just a nurse management or just a doctor. We have the psychologists, we have the nurses, we have the support workers, we have the lab scientists. So it's given in an interdisciplinary team approach. When deciding on the patient care with evidence-based practice in palliative care, it is important to use information proven by research result. That's what we are talking about, evidence-based. It's talking about the kind of care you give that is has been scientifically proven to be true, scientifically proven to be effective. You don't just use doctors only just use care that just based on their intuition. I think we should do this. Don't you think? It's not based on suggestions or experience. It must be based on scientifically proven facts. Okay? It's important to use information proven by research results in a careful, attentive, clear, and logical way, as well as considering the preferences of patients. You also have to consider the patient. Is this care? Does the patient accept this care? Is the decision I'm taking an informed decision? What is the patient's take on this treatment approach I'm about to take? So today we'll be looking at those treatment approaches in palliative care. Okay. Evidence-based practical treatment procedures in palliative care in a home setting, otherwise known as the 8 domains of palliative care. Now, we are talking about the treatment procedures in palliative care. Those treatment, how do you offer these treatments? What are the procedures you must take in offering care, palliative care in a home setting? Like I said when I started, palliative care is a kind of care given to patients suffering from terminal illnesses. So their treatment procedures are different from the conventional ones. Like you just take a patient to the hospital, some just give them physical care and chemotherapy, and that will be enough. But in palliative care, there are 8 domains of care that must be given, 8 treatment procedures that must be given, and they fall under structure and the process of care, structure and processes of care. So somebody can also ask you, what are the 8 domains of palliative care? If the person is otherwise saying the treatment procedures in palliative care. Number 1 is structure and processes of care. We're going to look into each and all of this: structure and processes of care, physical aspects of care, psychological aspect of care, social aspect of care, spiritual, religious, and existential aspect of care, cultural aspects of care, care of the patient at the end of life. Another aspect of care is the ethical and legal aspects. Okay, let's look at these aspects individually. Okay, structure and process of care. Palliative care starts with the patient's diagnosis of life-threatening disease, continues with treatment, and ends with supporting family during the process. Palliative care starts with the patient's diagnosis of life-threatening disease, continues with treatment, and ends with supporting the family during the grief process after death and treatment. In this process, it is recommended that nurses or healthcare givers who spend most times with patients and their families and take part in all aspects of care, use a valid evaluation tool. So you have to, in this stage of care, you have to prepare what measures. This is the first stage after the diagnosis. What you should do, you should set out your structure and process of care. How is this going to take? For how long? Each week, what am I going to do? What evaluation tools am I going to use to diagnose or to treat this patient, to evaluate the patient's care, to evaluate the patient's care or evaluate the care given to the patient. It is the stage you do that. You prepare everything you need, the team meets, they have a discussion. Okay, in this diagnosis, what plans are we putting on? What evidence-based plan can we put on to ensure that the patient fully receives the care he needs? Okay. Example of such tools include National Early Warning Scale, National Early Warning Scale, used NEWS. This scale is used to determine the patient temperature, the pulse, the respiration, the blood pressure, the oxygen saturation. These are the tools you use in this first stage to determine, okay, what process of care am I going to, what structure? The first thing is to take up your evaluation tools. And one of the tools here you can use as a caregiver, as a nurse, it's National Early Warning Scale. Another one is Glasgow Coma Scale. Glasgow Coma Scale. This scale is used to check the patient level of consciousness. So you can have a patient who is unconscious. You don't just watch the patient. You have to check and ascertain the level of consciousness to aid reporting and to determine at the level of severity of the patient's condition. The next scale you would use or evaluation tool, these are all evaluation tools, is two-stage capacity test, Addenbroke's cognitive examination scale. So these are those tools that will help you in your structure and determining the process of care you will administer. Okay, another aspect of care, which is the treatment procedure, is you have to also look at the physical aspect. The physical aspect has to do with managing physical symptoms with prescribed medications. I repeat, physical aspect of care has to do with managing physical symptoms with prescribed medication. A patient who is passing through terminal illness like cancer will be displaying so many symptoms. Dementia or patient with motor neuron disease will display certain symptoms. So you also have to look at the physical aspect, which is to manage those physical symptoms, noticeable symptoms. These symptoms include pain management. For pain management, you use opioids and morphine. Those are the medications you use, opioids and morphine. The patient can also can be dyspnea, you use morphine, nausea and vomiting, you use drugs like metoclopramine and alloperidol. Those are the drugs you use to manage those physical. There are so many physical symptoms. I just listed some here, so you can go back and research more on the physical symptoms, more physical symptoms in palliative care. It depends on the patient's condition. So these are the most obvious one. Pain will always be there. Most times, patient will feel nauseated. The person will have many gastric issues like that. All right. Are we on the same page? Are we on the same page?
Yes, ma. Yes, ma. We are only.
All right.
Thank you.
Thank you. Let's look at another aspect, the psychological aspect of a patient who is having terminal illness. Most time will feel very frustrated, will feel depressed, will feel that my world is crumbling, I'm about to die, I will soon die, you know. That feeling of fear and anxiety and all of that will set in. So you as a caregiver or a person who is offering care to that patient, you have to reassure the patient, because the psychological aspect of care has to do with dealing with emotional symptoms, mental distresses. For instance, picture a patient struggling with anxiety, always asking you questions. If you're a nurse, is it true I'm going to die very soon? Is it true that there is no cure to this sickness? Is it true that um, there's no solution to my illness? Like for instance, when I was in the psychiatric setting, a patient will walk up to you and say, is it true that psychiatric illnesses cannot be treated, but can only be managed? You won't come up with a very plain, you have to have wisdom on how to go about such answer, because your response will go a long way of determining how the patient will feel after leaving your office. All I would just tell the patient, your condition will be managed right, and the best thing is that you will not see the symptoms again. Once you don't feel the symptoms, then you don't have any problem. The primary thing is to combat the symptoms. So once the symptoms are gone, you are as good as being fine. Forget about the aspect of if it can be treated or it cannot be treated. Once you don't have the symptoms, you are as good as being fine. So you should always have words to know how to allay the anxiety of your patient. Palliative care professionals provide emotional support, counseling, and therapy to help patients cope with their illness and improve their mental well-being. For patients that they can be so disturbed to a point that the anxiety stage will become neurotic. So for patients with anxiety issues, you can give them benzodiazepines and antidepressants, anti-anxiety drugs to help solve those issues. Okay, we are in another aspect of care. We have looked at, when we began, we started with the structure and process of care. And the structure of process of care, we look at evaluation tools, and we mentioned few evaluation tools like the news, the Underdog scale, Glasgow scale, and the likes. We looked at the physical aspect of care, which has to do with managing physical symptoms. I'm trying to just recap so that we will not just be running. The physical aspect of care, managing symptoms, and some few medications I mentioned there. We talked about the psychological aspect of care. Let me just go back. Look at the psychological aspect of care, which has to do with managing their emotional and mental distresses. And I mentioned that patients with those kind of terminal illnesses are prone to be anxious. They'll have anxiety, they'll be depressed, and many questions will be going on in their hearts. So, and the treatment measures we can also administer. Let's continue. So now, the social aspect of care. Patients in this category tend to be withdrawn. You can also link the social aspect of care. It has a lot to do with the psychological aspect of care, because when somebody is affected psychologically, it will definitely affect their social aspect of life. So a patient who is depressed will not want to associate with anybody, will not want to even talk to the family members. So that brings us to the social aspect of care. The social domain emphasizes the importance of relationships, social connections, and community support. The social domain emphasizes what? The importance of relationships. That's friends, families, colleagues at workplace, social connections, and community support. Imagine a patient feeling isolated, disconnected from loved ones, or struggling to maintain relationships. Palliative care teams, facilitate communication, provide emotional support, and connect patients with community resources to strengthen social bonds. As a caregiver, you encourage the patient to associate with his family, encourage the patient to join groups, people who are like-minded, maybe people who have similar illnesses. There are groups of people like that. The association, like some people who have diabetes, there's a group, a peer group of people, so that they'll come together and receive treatment, receive counseling, and to encourage patients to join those groups. Because as a patient joins those groups, you can meet someone, a friend, or be as a sort of encouragement, be as a sort of emotional support to the patient, instead of the patient being indoors, or maybe if it's in a hospital setting, just staying on his own and not associating with other patients. So you should, as a caregiver, be able to ensure that you offer the social aspect of care by encouraging the patient to have social connections and participate in communal groups. Okay. So far, do we have any questions? So far, do we have any questions? Okay. I think there is none. Let's continue to the spiritual, religious, and existential aspect of care. Spiritual, religious, and existential aspects of care. Okay. The spiritual domain explores the patient's value. Before I continue, in healthcare, like I said, these are evidence-based measures. Before now, the spiritual aspect of care of patient was not included in the procedure of treatment, but now it is fully imputed because many people believe in one thing or the other. They have a a creator. They believe that there's an existence of a creator. So not minding whoever they believe in. So you have to acknowledge the patient's belief, and because it can also add to the treatment, it can also add to the recovery of that patient. So the spiritual domain explores the patient's beliefs, values, and meaning making. A patient grappling with a sincere question, asking, is there God? Um, what's the cause? Is my problem spiritual? Is it medical? And all of that. You have to bring in the spiritual and religious aspect of care, so that you as a caregiver will be able to answer some of those questions that will be raised by the patient. The patient will be seeking purpose or struggling to reconcile their faith with their illness. Struggling to reconcile their faith with their illness. So palliative care professionals provide spiritual support. They provide spiritual support. How do they do this? In hospitals now, they permit pastors, clergymen to come around at a certain time, maybe on Sundays, in the evenings, to have time with patients quietly, coordinatedly. So it's been included in the aspect of care now. So you can call a chaplain, can call their pastor. They say, please, I want my pastor to come and pray for me. Don't say, no, this is not a spiritual problem. You don't have to say that. If the patient believes that calling a pastor will go as far as helping relieve the symptoms according to the patient, you should also believe what the patient believes and call the chaplain to pray for the patient. It doesn't harm. That will not stop you from offering your medication. That will not stop you from continuing in your other aspects of care. So you have to connect the patient with disciplined spiritual leaders, or facilitating meaningful conversation with the patient. If you have the ability to engage on spiritual or religious aspects conversation with the patient. You can go as long as doing that. Okay. Let's look at another aspect of care. Another aspect of care, we want to look at the cultural aspect of care. The cultural aspects of care. The cultural domain acknowledges the significance of cultural values, beliefs, and practices in shaping patient care. I take it again. The cultural domain acknowledges the significance of cultural values, beliefs, and practices in shaping patient care. Please, can you mute?
Oh, I'm sorry. I'm sorry.
Okay, ma'am. The cultural domain acknowledges the significance of cultural values, beliefs, and practices in shaping patients' care. Envision a patient from a diverse cultural background whose values and traditions are essential to their care. Palliative care teams strive to provide culturally sensitive care. Cultural sensitive care. Okay, I forgot to mention this when it has to do with the religion, but let me explain it under this culture. You know, some people, some settings believe that blood transfusion shouldn't be done. In their own belief, they don't need it. So as a caregiver, as a person who is offering that aspect of care, you shouldn't impose. They should be try counseling, not persuasion, try counseling and encouraging the patient to take the blood transfusion. If he doesn't still accept, you should also look for another measure. Maybe you can say, okay, start taking vegetables, take blood tablets, hematinics, and all of that, and try your own aspects. You shouldn't impose, you shouldn't try to force treatment measures or treatments on any patient. Also, talking about culture, some culture doesn't like a male doctor attending to their wives, especially during delivery. So, like in the healthcare setting, we have male and female caregivers, doctors. So in that case, you not say if it's not a male doctor, we should also try to prioritize what our patient wants. So in that aspect, where the culture says we do not want a male doctor to attend to my wife during delivery, the healthcare setting, the interdisciplinary team should make a provision for that. So care must be culturally based, we must learn to respect the patient or the client's culture and beliefs, their values and practices. But in any ways, it should not interfere to the patient's well-being. That means the patient should not be harmed in the process of you permitting their culture. But if you try as much as you can and they refuse, they have to sign, they have to put it into writing so that all things must be equal. All right, thank you. Yeah, we are still progressing. I think I've put a balance to that. Health professionals should provide a professional medical interpreter. Okay, this has to do with for patients who speak another languages. If you are dealing with an aged patient and that patient also doesn't understand English, there should be an interpreter to be able to interpret what you're saying or your conversation or your treatment measures. There should be an interpreter to interpret in the patient's language for easy communication. Because in caregiving, communication, effective communication is one of the vital tools. We will look at that. We'll look at that tomorrow when we are talking about leadership, healthcare, professional leadership care to clients. So we'll look at effective communication when it comes. So without effective communication, there will not be effective treatments. So there will have to be an interpreter to aid communication. Okay, we are now at the sixth domain of care, which is care of patient nearing the end of life. Care of patient nearing the end of life. The primary goal of end-of-life care is to provide emotional and spiritual support to the patient and the family. To provide what? Emotional and spiritual support after this series of care, psychological care, social aspects, and still get to the point where the patient will have to, should I say, will have to die. Okay, at this point, you still have to be there for the patients. You have to be there for the family, both emotionally and spiritually. Health professionals shall discuss the progression of the disease. The patient will want to know, please, what's happening to me? You say, ma, unfortunately, we are getting to the last stage of this disease, like we are in the end stage of this cancer. And as it is, you might not live longer than this. You try to reassure the patient, tell the patient, just give the patient some word of comfort. I know it will not be easy, but the truth must be told, but with wisdom, you know. So nurses shall evaluate, or caregivers shall evaluate the effectiveness of care provided to the patient during the terminal stage. There will be an evaluation. Have I been able to meet up with my plan? No, in this case, it's a care plan. When we started the beginning, we talked about the structure and process of care. At that stage, you will set up your care plan. In care plan, there's always an outcome identification. There must be a timeline. There's a timeline to your treatment. From this time to this time, this is what I hope to achieve for this patient. So in this stage, care of patient nearing the end of life, you evaluate your care plan and say, okay, what have I been able to achieve so far? Have I been able to achieve this? Was I able to allay the patient anxiety at this stage? Was I able to offer psychological support to this patient? Was I able to answer existential questions? You know, at this stage, you begin to evaluate and you begin to discuss, okay, do you have, who is your next of kin? Have you been able to sort out things in the bank, in your offices, your successor and everything? All of these things should be discussed at this stage of care of patient nearing the end of life. So that takes us to this aspect of care, which is the last aspect of care, the ethical and legal aspect of care. Before we take the ethical and legal aspect of care, let's take up this little task before we do the last aspect of care. Let's take up this little task. You're going to submit it to the phone number I'm going to call to you. You're going to submit it either immediately or few minutes after this session. Number one, highlight the 7 C's of palliative care. I know I've not mentioned it, but I would like you to give it a try. Highlight the 7 C's of palliative care. Highlight the 7 C's of palliative care. Now, the next question is, physiological care is the same as physical care. Physiological care is the same as physical care. True or false? I would love us to just talk about it a little bit. Physiological care is the same as physical care. I would like somebody to give me a response.
It's not the same.
Okay. Why? Why do you say so?
Because psychological, you are trying to talk to them. But it's not
I'm
the
talking
same.
about physiology, not psychology.
Oh, sorry. Physiological care is the same as physical care. Well, yes, because physiology and physical, I think it's the same. Yes, it is.
Okay, someone else should try. Okay. I don't want to give the answers now. I just want everybody to try the task. Then I'll give my final answer. Okay. Thank you very much, ma'am, for that attempt. Thank you. Okay, the next question is pains, breathlessness, nausea, and vomiting is associated with what domain of palliative care? Pains, breathlessness, nausea, and vomiting is associated with what domain of care? By tomorrow, I'm going to, just before we begin the next class, I'm going to give answers to this question, especially for B, so that we'll get clarity. But just submit your answers to this number, 091 1831 4047. 091 1831 4047. Just submit your answers. The next 15 minutes, just put it up there. Then tomorrow, before we begin the next class, I'm going to give us the answer to B, because we already have the answers to A and C in this slide. Okay.
Sorry, can I repeat the number? 091
091 1831 4047.
Thank you.
All right, ma'am. Thank you. Okay, let's go back to the last aspects of care. Ethical and legal aspect of care. Ethical and legal aspects of care. Health professionals shall develop a care plan that includes terminal stage instructions for patients requiring palliative care. Care plans shall include subjects such as identification of persons to make informed decisions on behalf of patients. It will get to a point sometimes in the process of care where the patient is unconscious, or the patient cannot talk again, or the patient is not mentally active again. So before you begin, like still under the process of care, there will be a sort of a template or a form for the patient to feel, okay, this is the person that will speak for me. This is the person that will do this for me when I'm able to make some decisions in the process of me receiving this care. So that has to do with autonomy. There's going to be a sort of signing, lawyers will be involved, and the rest. We also have the beneficence, non-malfeasance, justice, rights to resuscitate. You know, there's some patients who have passed through so many health issues and they say, don't try resuscitating me. All of those things will be put down, will be written down. Okay. when I'm about to die or when I die, don't resuscitate. Some people say, so all of those things will be considered under the legal aspect of care and the emergency treatment. So we have come to the end of today's class, almost to the end of today's class. I just want to give a little tip on the 7 C's of palliative care.
I know it.
Now, what did you say?
I know some.
Okay, that's beautiful. Okay, well, you can just tell me some of them.
I know of communication.
All right.
I know of to have compassion. Can I remember compassion? Then
Yes.
I know of to collaborate with family collaboration. That's the 3 I can remember.
All right. That's awesome. Thank you very much, Ma. Okay, let's check the next slide for that. Okay. Some school of thoughts have different things. Collaboration is one of them, but I didn't put it in my own. But if you check other school of thoughts, you will see it too. We have the 7 C's of palliative care. We have control of symptoms, managing symptoms, pain, and distressing symptoms to improve quality of life. We also have comfort, providing physical, emotional, and spiritual comfort to patients and their families. We have coordination of care. Coordination of care. Care planning and coordination in all palliative care in home setting is based on a team approach. We also have carer support, providing comprehensive patient-centered care that addresses physical, emotional, and spiritual needs. We also have communication, like Amomi said, communication, effective communication between healthcare providers, patients, and families to ensure informed decision making. We have continuity of care, ensuring seamless transition and continuity of care across settings and providers. Talking about continuity of care, whatever care you render as a caregiver must be documented and must be passed down to the next person who is taking over from you. You will not stay there all through 24/7. Even if you do, there are other team members that need to continue the aspect of care you had started. So there has to be documentation. You have to write it down, and you also have to maybe say it verbally to other team members. So there has to be continuation of care. There also have to be compassion. Compassion, like it was mentioned earlier, providing empathy, not sympathy. We are going to say the difference. Somebody will help us. Providing empathy, compassionate care that acknowledges the patient's and family's experiences, values, and beliefs. Providing empathy, compassionate care that acknowledges the patient's and family experiences, values, and beliefs. So those are the 7 C's of palliative care: control of symptoms, comfort, coordination of care, carer support, effective communication, continuity of care, and compassion. It was just an amazing class. So before we end, please don't forget to submit your tax to that number I mentioned earlier, 09118314047. I said we will say a little different because some people mistake empathy for sympathy. In caregiving, we are encouraged to only give empathy in our process of being compassionate. So I'll just need a little highlight, the difference between empathy and sympathy. Who can help me? Or should I call someone? Empathy and sympathy. Okay. Empathy has to do with you, like say, putting yourself, like they used to say, in the patient's shoes, having the feeling, okay, what if I'm the one passing through this condition? How will I feel? How will I want to be treated? That's the same way you will treat the patient, with support, feeling the same way the patient would have felt. Or, that's just what empathy is all about. And that's what we should give as caregivers. While sympathy is just being all emotional, like you can even cry for the patient, you can even complain and all of that. That's not what we are supposed to do. We are not supposed to be carried away by what we see. Maybe we see a patient, a patient relative is crying over the loss, and you just join them in crying. That's sympathy, and it's not what we should do as caregivers, but we should rather be empathetic. Okay. Do we have any questions? I think we've gotten to the end of this class. Do you have any questions? Okay. I think we've understood everything that was said here. Okay, this is, like I said earlier, just want to recap, this is Moricol Health Services. We offer a range of services like massage therapy, online pharmacy and on-site pharmacy. We have pain management, we have recruitment, we have telemedicine, and many other aspects of services that we render. Trainings, both online and in-class training. This is one of our training platform or programs that we've connected. We also have deeper trainings that will help you get certification that is honored both in Nigeria So should you need any advice, should you need any guidance on these services we offer, don't hesitate to call that number I messaged earlier, or check our website, Moricol Health Services Limited, or our social media handle on Facebook, Instagram, YouTube, and LinkedIn. We have our website is www.moricolservices.com. Go there, you will see so many things about us, and you'll be glad you did so. All right. Thank you very much. It was such an interesting time together learning about evidence-based palliative care treatment measures in home setting. So I believe we've gotten something, and we are ready for the assessment. Once we are done with all the trainings, which will be ending on Thursday, we will be having our assessments, and each of those assessments comes with their certificates, and then each certificate goes for 5,000 naira. Just a token of 5,000 naira. It's not too much, and it will aid and it will add to your CV. Thank you so much for listening. Thank you so much for being here. Despite your busy schedule, you had to carve out time to be here. We really, really appreciate it. So please prepare for the assessment. If you need to listen to the class again, you can go to our YouTube channel and you will see the live session. Okay, somebody raised his hand.
It's okay. I'll put it down.
What did you say?
You've answered my question. Just to go back for recap on your website, yes?
Okay. Thank
Those
you.
started for someone that joined today. So I'm just wondering. Hello? Hello?
Yes, ma'am.
I say for someone that just came in newly today, they can go to your website and study everything and learn what we have done. Network.
Okay. What did you say, ma'am?
I say for someone that just joined newly today, where can they get all the like all the things that have been done?
It's still on the YouTube channel.
Okay. Okay. Thank you.
Thank you.
For your time for this training. God bless you.
All right, and you too. Have a great day.